A very good afternoon to all of you. This is Dr. Ruchi, founder and director of an organization called as Pediatreat. Today I'm here, I'm doing live after a lot of time, and I'm here to explain you a short case, acute case of high-grade fever. He's a child of 7 years of age, and he had a very high-grade fever, around 102 and 103, and yeah, they had come so he's a regular patient of mine, and he used to come to me for some other ailment, and he's better with those complaints. His regular constitutional medicine that I was giving was phosphorus, right? So one day his mother called me up and said that he has high grade fever. So now what to do? So I said, okay. So the basic question in fever in this live, what I want to say or comment on is how to take a case of fever, what questions you should ask, when you get all the data, how you should process that data that you come to the right remedy. And third, if you come to the right remedy, how you should dispense in cases of fever, how much you should wait, what you should do. So these, because I was, discussing some acute cases on YouTube, but I thought that because I'm just telling the symptoms of the patient and then the totality and then the remedy. So probably the process is very, very important, which I thought is not conveyed rightly in those YouTube videos. So I thought of going live and, we can discuss together how to approach a case of fever, high grade fever, or any other acute in pediatrics or even an adult for that matter. So as I said, that he's a regular patient. Mother called up that he has got high grade fever. So the first question that we all are supposed to ask is, what does the child do during fever? Is there any change in his behavior? मतलब during fever क्या करता है बच्चा? तो mother said कि हाँ बहुत बड़बड़ कर रहा है. He's talking a lot. बहुत ज़्यादा बातें कर रहा है. And उसको वॉमिटिंग हो जाती है फीवर में, पेट दर्द होता है, नौशिया हो रहा है, एंड देन ही वॉमिट्स, एंड देन वो बहुत डर जाता है, उसको वॉमिट से डर लग रहा है, राइट? आई वांट यू ऑल टू आल्सो पार्टिसिपेट. इफ यू कम टू, आपको कोई रूब्रिक्स लग रहे हैं या टोटलिटी या रेमेडी लग रही है, तो प्लीज आप बताएं वो रेमेडी. यू कैन पुट योर पॉइंट फोर्थ, राइट? सो एंड थोड़ा लेटा हुआ है, थोड़ा सा डल है, पर बातें कर रहा है बहुत, और he's continuously talking. And yeah, so I took few rubrics because he said vomiting से डर लग रहा है, मुझे vomiting से डर लगता है. So I said okay. So I took fear, vomiting off, loquacity, fever during, and such rubrics, and I had prescribed Lachesis. And I said, you call me up after say 5, 7, 10 hours, whatever. Probably evening she called. I said, tomorrow morning you call me up. So the mother said, no, night also he had 103 fever, 102 fever. And this child lives very far from my clinic, right? Almost 20 kilometers. So because in small kids now, it's a little risky to see them on video consultation because you cannot check them. And when they are in, you are seeing them through mobile or laptop screen. So mothers also restrict the kids. So movement nahi hota hai. So I said, you please come down to the clinic. Said, okay. So she, next day evening they got the child. So almost 24 hours ke upar ho gaye the bachche ko fever se. So then I asked, you should be always very open. Let all the data come in first. फर्स्ट पहले बच्चे से पूछा क्या हो रहा है, तो बोला फीवर आ रहा है. मैंने कहा जब फीवर आता है, आई एम टेलिंग ईच क्वेश्चन एंड आंसर बिकॉज इट हेल्प्स यू टू ऑल्सो अंडरस्टैंड हाउ द केस नीड्स टू बी टेकन. सो आई सेड जब फीवर आता है तब आप क्या क्या करते हैं? तो बच्चा बोलता है पैर दुखता है मेरा, उल्टी जैसा लगता है, मेरे को उल्टी हो जाती है, अच्छा नहीं लगता है. तो मैंने बोला अच्छा और क्या होता है, क्या करने का मन करता है आपका? तो बोला मेरा लेटे रहता हूँ, मैं मम्मा से बात करता हूँ. Then I asked, और तो बच्चा was not able to tell beyond that. So then you go to the parents कि आप बताइए क्या होता है. तो बोले अरे बड़ा अजीब सा बिहेव करता है, बहुत बड़बड़ करने लगता है, कल रात को तो बोलने लगा कि मेरा बैग भर दो, मेरे को स्कूल जाना है, मैं स्कूल जाऊंगा, मैं एग्जाम में फेल हो जाऊंगा, आपको नहीं पता है, मेरा बैग भर दो. ऐसे बार बार ही वो सेइंग कि I want to go to the school. I said एग्जाम्स हैं क्या? तो बोले हाँ, उसको थोड़ा टेंशन हो रहा है एग्जाम्स का. I said okay. मैंने बोला क्या लग रहा है, फेल हो जाऊंगा मैं अगर एग्जाम में नहीं गया. मैंने बोला okay, what else? तो पहले what else, okay, don't ask a leading question directly. Okay, क्या आपको, you come to 2 remedies and then you start asking confirmatory questions, because once you do that you will always fail because you are blocked towards 1 or 2 remedies. So I always ask open-ended questions first, right? तो okay, anything else? तो she said, चाहता है कि हम इसको पकड़े रहें, मतलब he wants me to hold his hand, mother to hold his hand. और इसको थोड़ा पढ़ाई की टेंशन हो रही थी और टेंशन में आ गया था फीवर में, जैसे डर गया हो फीवर आने की वजह से. तो मैंने बोला क्यों डर लग रहा था आपको फीवर से? तो ही सेड कि मुझे लग रहा था पता नहीं मैं ठीक हूँगा कि नहीं. सो द चाइल्ड सेज आई एम नॉट वेरी श्योर वेदर आई विल बी फाइन और नॉट, और मुझे डर लग रहा था. तो आई सेड ओके. देन mother said कि पानी भी थोड़ा थोड़ा पी रहा है, he's taking sip by sip, he's asking a lot of water but takes a little, and anything else. when you ठंड लग के बुखार आ रहा है, उसको पैरों में दर्द होता है, वॉमिटिंग जैसा लगता है, खाना बिल्कुल भी नहीं खा रहा है, अगर खाने का नाम भी लिया तो बोलता है स्टॉप डोंट टॉक, आई फील नॉशियस, डोंट टॉक अबाउट फूड, आई एम नॉट लाइकिंग दैट यू आर टॉकिंग अबाउट फूड. और ठंड भी लगती है उसको, और खाने के बात भी करो या बोलो हम ये ले आए तो he just stops us कि मत लाओ, right? So this is the data that you have got. So why I'm taking this case, you every time ask me whether you consider physical, whether you consider mind, how to go about it. It's not about me, it's about the right method that we all have learned, right? So when you have taken the case, you have got all the data, then just try to point out all the symptoms that you have taken, convert them into rubrics, whether it is a physical rubric or a particular rubric or a mind rubric, right? So you all will help me now to form the rubrics of whatever I have told you, right? तो क्या बोला हमें हम सबको पता है, हमने BHMS में सीखा है कि we are supposed to take the mind first and the physical general second and the physical particular last, right? So what all rubrics will you take? We know that the child is scared during fever. He's worried about his exams. He feel that he'll fail in the exams if he doesn't go to the school. He said, I am not very sure whether I'll be fine or not. So he's doubtful that he can, come out of this fever. So all this is a state. Physically, what we are saying that he's getting nausea, he's getting vomiting, he's getting abdominal pain during fever, he's got leg pains during fever, nausea even at the thought of the food, baat bhi karo to food ki, to he's getting nauseous, yeah, and he's talking a lot during fever, yeah. So these all symptoms we have got during fever. Till now, whatever cases I have shared, we have taken 4 or 5 symptoms, form a totality and prescribed. But such cases जहाँ पे आपको बहुत data मिल जाता है, 10 मिनट में fever में, I was able to take 20 rubrics, right? So I converted all of them into rubrics. आप partially देखेंगे कि भाई चलो बच्चा thirst sip by sip ले रहा है, anxiety है fever की, so should I give arsenic? Are you understanding? और बच्चे को बुखार में भी एग्जाम की चिंता है, फेलियर की चिंता है, तो should I think about a rubric anxiety lessons about in school children which has only 2 remedies? What are those remedies? Silica and lycopodium. So should I give silica or lycopodium because during fever also he's worried about his exams and studies? Or I should consider thirst sip by sip and give, or should I consider fear vomiting off and loquacity and all this totality and stick with lachesis only, which I have already prescribed? So all these thoughts play in your mind, right? All these thoughts should play and plays in your mind because you see what you know, so you tend to pick up the things you know and you just pick up those 2-3 collection of rubrics and say, okay, I'll give lachesis or okay, I'll give arsenic. That is not the right way. The right way is more logical, more objective. There has to be something firm on which you can stand, on which you can say, oh, my totality is right? It's good to have differential DD medicines, but it's always nice that you stand on a strong totality. You know why you prescribe that given medicine, right? So come on, so we'll analyze this case now. So the rubrics that I took was anxiety fever during, frightened easily fever during, delirium fever during, कुछ भी बड़बड़ कर रहा था, जब बच्चे derailed हो जाते हैं बहुत अजीब सा बिहेवियर करते हैं ड्यूरिंग, विच इज नॉट वेरी नॉर्मल. वी टेक डिलीरियम. सो delirium fever during doubtful recovery of the child himself said कि मैं इससे बाहर आऊंगा कि नहीं, मैं ठीक होऊंगा कि नहीं. तो he is doubting whether he'll recover or not, right? He wants mother to hold him. So held desire to be held. अगर ये opposite होता कि he is holding the mother's hand, तो we can take holding mother's hand, child constantly holding or clinging. He is not clinging. He wants mother to hold him. So held desire to be held. Loquacity fever during and fear failure of. So these are the sets of rubrics that I took at the level of mind. And then I took physical rubrics like chilliness fever with, thirst small and often, nausea fever during, nausea thought of food from, abdominal pain fever during. So I would say take everything, analyze everything. And second part that comes is very, very important is evaluation, Then which symptom is that I cannot miss in this case, So for me in this case was all these mentals, where he has doubtful, he has anxiety, he was, and fear of failure, delirium, loquacity fever during. So I took this, and then I took thirst small and often, and then I gave the medicine, whatever I have to give. So sometimes, we have specific images of medicines during fever, like loquacity baat karega or fear of vomiting. We have made these combinations in our head, right? So sometimes great, and sometimes no. They can make us fall in a trap, and we cannot form the exact totality. So you can write it in the section, at some corner in your case paper that I'm thinking of arsenic or lachesis or whatever. Like in this case, I wrote that if we consider thirst sip and the weakness and anxiety, we can think of arsenic or we can think of lachesis, but always and always make a totality. So after making the totality, the medicine that came was sulfur. Sulfur was standing tall as compared to rest of the medicines. And there were firm grounds which felt that no, I should give sulfur. Though sulfur we do not give very, very frequently in acute cases. Last time I shared a case where I gave alumina, right? So there has to be a reason. You don't have to be prejudiced ki, okay, this medicine we cannot use, or this medicine. I have used any medicine for fever and any medicine for a chronic complaint. So we should be out of these our own prejudices, right? So I gave sulfur 200 water dose. I have already explained how that I have give water dosage in cases of fever. So I gave sulfur 200 water dose every 1 hourly or 2 hourly till the fever comes down. So the next day mother called that yes, he's much better, that बड़बड़ करना या कुछ भी बोल रहा था और टेंशन ले रहा था, वो सब बिल्कुल खत्म हो गया है. But the fever is still 9900. The nausea has gone. He started eating. So I said, okay, continue the medicine a little more, less frequently, like give it 3 times a day or something. And within 2 days, he was fine. He's all fine. All his weakness and loquacity and everything went. So this is an acute case of fever, which we treated with sulfur. Here, the reason behind presenting this case is not that I teach you sulfur or teach you that, oh, I have treated 103-degree fever. Everybody treats. I am very, very sure about it. The reason is that I should teach you or make you aware about how to form a totality, how to form the exact evaluation, and do it in your clinic. Don't fall on traps of fixed images or fixed, thinking कि अच्छा thirst sip है और weakness है तो let me give arsenic. Don't do that. Convert each and everything that has come from the patient, especially from the patient, make a totality, and then only you can give a wonderful result. Believe me, nobody on this earth can teach you all the remedies of fever. Even I sometimes is surprised that, okay, I'm giving Veratrum. And I'll tell you one more thing. Before he was going, like I had prescribed the medicine, the receptionist had prepared the medicine, and then he was smiling. I said, kya hua? He said, I want to eat pani puri. The medicine has not yet I have not given one dose. I'm not saying that, oh, I gave and his nausea is gone. No. He said, I want to eat pani puri. I said, now so you were saying that I have nausea. He said, parents said, no, whenever he comes to your clinic, there is a shop nearby, so he wants to eat. I said, okay. So I said, he's fond of eating. They said, yes. So I didn't change and put gourmand, If you add also gourmand, Veratrum calcarea was not covering the rest of the totality. And it is not gourmand, it is contrary. The rubric should be contrary. कि अभी बोल रहा है nausea और अभी बोल रहा है कि खाने का मन कर रहा है, right? So always take the right rubric, stand on the firm totality, always give value कि भाई this symptom, for me in this case, doubtful recovery, anxiety fever, delirium fever, loquacity fever is very, very important. And then comes obviously fever, chilliness with and rest of the totality. And then you give the medicine. 99% of the cases, your medicine will not fail. So to have a wonderful result, there is two combination of things that we should know. First, as I have already said, that, make a good totality. And second is the knowledge of materia medica. I always say it is second because I may not know baptisia very well, but if I take the rubrics correctly, I may come to baptisia. Are you understanding? So I would always give more value to the repertory and second to materia medica, because practically I feel it is impossible for me to learn 300 or 400 remedies of fever. But I can always learn the art of coming to the right rubric so that I can come to the right medicine. And then I can go back, suppose two medicines are coming like pulsatilla or sulfur or pulsatilla veratrum. Then I can always go back to materia medica and read about it and then give the final medicine. Are you all understanding? So this was a small attempt to tell you that, the process of forming a totality and process of coming to the right remedy. Okay. If you have any questions, you can ask your questions. I'll be more than happy to answer them. There are a few more announcements that I have to do. Is first, you all know that we are taking sessions on rubrics. We have already done 8 sessions and we are doing it from alphabet A to Z. We have already reached D. So yeah, they are liked by all because this is a very base, and I know I strongly feel that if this you know and understand, it will really take you a long way. So now our first 3 rubric sessions are available for downloading. You can buy those 3 sessions in just 1,000 rupees. 300, 3 hours of each session, and you can download it, study. It's not about those rubrics only. You will also understand the style of, learning or studying or approaching a case. That is very, very important. You can tomorrow explore more rubrics, which probably I am also not aware of. So I, as a small individual or a teacher who wants to give a little bit of what I have learned in life, I strongly feel that I don't want to teach you calcarea, lycopodium, cuprum or pulsatilla. I want to teach you a method that will help you to stand on your own feet, that tomorrow you can learn 10 more remedies and teach 100 more students, right? So in my webinars or seminars, whatever I am able to conduct, I always make an attempt to tell you the process. The idea is not to tell, oh, I treated diabetes insipidus or diabetes mellitus. The idea is to make you capable of learning it and finding your own way, and finding your own path to reach to the right remedy. That is very, very important. Any questions that you have? I'm waiting for your questions because it's after a long time that we are doing live. Okay, ma'am, do you give crocin syrup in such times? Ideally, we should avoid, but for me, I have always stated this. For me, the child or the patient is of utmost importance. So if it is 103 fever and the child is not feeling well and it's uneasy, I'm okay if you give once in a while crocin or ibugesic. It's absolutely okay with me. So I'm not a very rigid person. I understand the pain of the child. I understand the pain of the mother to see the child in 104 fever. And I'm okay, right? I'm against antibiotics and everything. But crocin syrup or ibugesic once in a while is fine. I don't think it would create a lot of harm in giving that. Okay, anybody else? So the idea behind is that you should treat more acutes. So maximum number of people would have believe in homeopathy and not think कि 103 fever है तो we should go to allopathic only doctors. Have belief in yourself. You don't refer patients कि okay 103 है तो आप चले जाइए या आप antibiotic दे दीजिए. I've seen homeopathic doctors themselves giving their children a lot of antibiotics. I understand that you're not able to treat or they are not getting better. I'm not here to judge you at all. I'm the last person who would do that. But I want you to at least try. Have belief in yourself. If you are not, take help from anybody who's near you or whom you trust a lot. And, have belief in your system at least. Yeah, that would really take you... Very good afternoon. Anybody else who wants to ask any question? Yeah, I have one more announcement that 18th of March, side by side of these rubric sessions, I will be also taking sessions on pediatric cases because कितना भी हम बताएं जब आप actually देखते हैं बच्चा उसका mannerism, उसके expressions, it give you a different feel. You are able to observe, you are able to see much more that I'm able to tell you, right? So we'll on 18th of March, this will be also a series of pediatric cases, the way we are doing rubrics. So this will be I have taken few earlier also, but we'll start with this series on 18th of March. So 18th of March, which I think is Saturday, 3 to 5:30 with a minimum fee of 300 rupees. The recording will be available for 1 month. But these sessions will not be available later. So if you want to attend, you attend now because when we have videos of patient, we cannot put them on public forum, right? So if you want to attend the session, you can contact me. I'll put down my number also. And one more thing that everybody says, we sometimes go to the seminar and a lot of students to me also, okay, oh, you are doing so nice. How did you do it? How should we do? You share your journey so as you all know, I'm very fond of these poems or motivational quotes. So I would like to quote 2 lines. ना सोना हूँ ना मोती हूँ ना चांदी हूँ ना हीरा हूँ ना सोना हूँ ना मोती हूँ ना चांदी हूँ ना हीरा हूँ खास कुछ भी नहीं मुझ में खास ये है कि हर तरह की खासियत से आज मैं इनकार करना चाहता हूँ. So all the people who you see or you think are successful, there's nothing special in them. The only speciality that I feel all the successful people have is a little bit of hard work and more perseverance. They don't give in. So all the women, because the Women's Day is coming, and it's my dream to see every woman working at a larger forum also, but at least all the homeopathic doctors, all the women homeopaths who are sitting at home, who feel that, okay, I'll not be able to earn, get back on your shoes and start a practice. Start small, but dream big. You'll be able to earn as much money as you want. Money is always secondary. Believe me, it took a lot of time for me also. It doesn't come easily. So yes, there is a lot of hard work. There is a lot of perseverance, but success is guaranteed. So if you study, that is why I keep all my fees like 300, 400 or maximum 600 for 2 sessions, because I don't want to burden you all. I don't want to say, okay, 2,000 for 2 and I'll be doing it in this hotel and this. So that at the comfort of your home, at least you can start, you can come to the right person or the right who will not look you down, I'm telling you, I have gone through that phase, so I know it very, very well, So please start studying, start seeing patients, have confidence in yourself, get back to work. Don't think that you'll not be able to. You'll be able to reach to greater heights than we are able to reach. Tomorrow is, it will be brighter for you. Self-confidence and independence is must. Should not be a choice. I feel it. To work or not work should not be a choice. It's your basic necessity. It's your basic right to work. So you don't have to ask एंड आई ऑलवेज से कि सब कुछ इजीली नहीं मिलता है. ऐसा नहीं होगा कि इन लॉज भी मान गए, हस्बैंड भी मान गए, उन्होंने आपको क्लिनिक का इंटीरियर भी कराया. नहीं होता. यू हैव टू फाइट इट, यू नो. I actually asked my father-in-law 20,000 rupees when I opened my clinic. It was a very, very small place, hardly 80 square feet ka place. And I said, I want 20,000 because I wanted to do a cabin, you know. So it was, so you have to, either your parents or, I think jewelry to sabke paas hogi na. It's not, it is not very unseen dream kind of a thing. So all the women out there, all the homeopathic doctors, especially who are not working, who are working, obviously you will work hard, but those who are not working, start your practice. You know, it will give you a lot of worth. You will be doing justice to your own self, even to your parents who have, you know, इतनी रातें जगकर उन्होंने आपको इतने अच्छे schools में इतनी अच्छी education दी है. You will create and a better example for your children that, you know, you're working hard. That is more important. Yeah, so I really, really wish that you get that courage, you get that confidence to get back to work, of taking homeopathy to, you know, a new light, a new greater heights tomorrow. That is, I really feel. And don't get trapped on petty issues like this is this group, this is this group. We are homeopathic doctors. We have ये डॉक्टर का नाम, आप मेरा नाम बिल्कुल मत लीजिए. आप अपना काम करिए, आप अपने आप को अच्छा लेके जाइए. That is the whole motive, that the whole system should grow. If I say, okay, Dr. Ruchi ka bahut, it will not take you a longer way, right? And we are not politicians who forms groups like we are BJP or we are this. No, you learn from everybody. If you feel that I'll be able to contribute to your knowledge, you learn from me. If you don't like my style, it's perfectly fine. Find a person where you are able to learn. Find a teacher who will be able to help you. If I am, I'll be more than happy. But if you feel that, oh, Dr. Ruchi doesn't teach it the way I want you to learn, then you can find a teacher for yourself, you know, but find one, study hard, reach greater heights, start working. Today, I always say today is the right time. Don't think कि बच्चा upper KG में आ जाएगा तो मैं जाऊंगी, या first में आ जाएगा तो he'll come back at 3, so morning. The right time never comes, you know. There is no end. Then there'll be 10th, then 12th, and then you'll feel it's too late, right? So today is the right time. Right, so in advance, a very happy Women's Day. Thank you all. Do join the session on 18th of March, on session on pediatrics. And if you want the recording of Rubrics session, you can contact me. Thank you so much. I hope you treat hundreds of acutes in your clinic and reach great heights and success. Thank you. Thank you so much.